Hi, my name is Greg Fell, I'm Director of Public Health. This is a short video on what the next 6 months may look like, and I'll preface this by saying none of us know. So SAGE published some really helpful papers on their forward scenario modelling over the next 6 months or so, and this is a short summary of some of the key points. We've all clocked that we're well into the second wave. The dynamics of the second wave are really different from the dynamics of the first wave. Up until mid-March, when we went into the national lockdown, the reproduction number, or R0, of the virus was close to 3, and the epidemic was doubling every 3 to 4 days or so. The lockdown did what it was supposed to, no doubts of that, at the cost of significant social and economic harm. This time around, we're seeing growth again across the UK and in Sheffield, but a much lower and slower rate. So our R0 is currently somewhere between 1.2 and 1.5, and doubling times are in the 2 to 3 week range. And that reflects the package of interventions that are in place and have been in place since early to mid-March. And that has saved lives. What people have done by washing their hands, keeping their distance, wearing face coverings and a range of other things has definitely saved lives. And so thank you for that, because that's really made a difference to the dynamics of the second wave. What will the future look like? It's impossible to tell. My sense is that we'll have a very slowly declining rate of infection over the next couple of months. As a colleague of mine frequently says, we go up a ladder and down a slide. Sadly, it's a very sticky slide, and we come down that slide quite slowly. Where will we get to? I think the decline in infection rates will plateau and be quite slow. We probably will get R0 to 1, or hopefully slightly less than 1, by the 2nd of December. That's the stated aim, and I sense we'll probably get there across the country. Certainly in Yorkshire we probably will. However, we're at a much higher rate of infection than we were in the summer. So in the summer, rate of infection was in the order of 15, 20, 25 per 100,000. Now it's in the order of 300 per 100,000. So if we get R to 1, if it goes above 1, then there's a significant underlying infection in the population, and it can take off again really quickly, as we have seen. So I think there'll be limited room to relax interventions, because the absolute level of population immunity is pretty low still, actually. If we were in a scenario where 60-70% of the population had this illness, then we'd be in a very different position with regard to R0, rate of infection, the possible viability of relaxing restrictions. We aren't. We're probably still in the order of 10, maybe 11-12% of the population who've had this illness. So I think if we relax measures quickly, that could easily cause R0 to exceed 1 once again, and the rate of infection could rapidly take off. Relaxation following a peak of infection could be due to spontaneous changing of behaviour. People get fed up of this. I'm fed up of it. Who isn't? And we've seen that in other countries where there have been significant restrictions. People have got fed up and begun to ignore the restrictions, and the rate of infection goes up again. Hospitalisations and deaths will sadly follow. Or it could be government induced, and I think the government will continue to act really quite carefully here. So I think we've gone up the ladder. We're beginning to come down the slide. As I say, it's quite a sticky slide. There are 4 broad scenarios in the SAGE papers that were published over the weekend: high uncontrolled, high rate of infection controlled, alternating, spiking up and downwards, and low uncontrolled. And what we're trying to balance in each of those is the direct harm from COVID, the indirect harm from COVID on account of not being able to access healthcare for other reasons and for other illnesses, the economic damage, the social damage, and possibly the impact of whether or not, whether it will become available, whether a vaccine becomes available, and how quickly we can vaccinate the population. obviously the ideal scenario is to get the rate of infection low as possible and controlled. What do we need to do that? 4 things really: rapid and decisive actions to push R well below 1 and maintain that for some time. I sense we'll get to R hovering about 1 by the 2nd of December. I hope I'm wrong. Hope it's much lower than that, but I think it will be about 1 by the end of December. Ideally, it should be much lower. I think we will be in a space of some restrictions on our behaviour, some restrictions on our movement continuing for some time to come. There's a government call. That's not my call. I'm trying to guess here what may happen. Again, hope I'm wrong. Secondly, we don't know what future government policy will be with regard to schools and education. The Prime Minister's been pretty clear that education is really important for our children and young people for all sorts of obvious reasons. I suspect government will continue with that policy approach. Once prevalence is low and once R is well below 1, restrictions could be eased somewhat, but I do think substantial measures will need to be in place over the whole of the winter to keep R below 1 or preferably well below 1, or at or around 1. And I do think that we'll still be in a position where we're still reliant on people continuing to wash their hands and keep their distance, wear a face covering, where we'll continue to be reliant on test, trace and isolate scheme, and the usual set of interventions that actually have made a difference. So in summary, we are pushing for a low and contained virus. I hope we get there. I think prevalence will continue to be higher than we want it to be, and certainly higher than is comfortable for us for some considerable time to come, and that limits the ability with which we'll have to lift the restrictions on movement, I think, for some time to come.